I'm an assurance partner here in the Palo Alto office, and I work mostly with life science companies and then larger healthcare and college and university nonprofit organizations. And what I do is I oversee the audits on these for either venture-backed startups or small, medium-sized public companies or nonprofit organizations. And one of the things I also do is I'm involved in some community service work, and that involves sitting on the board of some nonprofits. One is a healthcare foundation called St. Francis Foundation, which supports the St. Francis Hospital in San Francisco. And another one's called Martin Luther Tower, which is a faith-based independent living senior care facility in San Francisco. We have a co-leader, and it's the Life Science Industry Group. Julie West is the co-leader. We've just expanded the group to include healthcare and hospitals, and so it's broader than just life science in that we'll serve people that are physicians or hospitals or other related healthcare providers. But generally, we have tax and audit and valuation people that are part of the group. As I mentioned, Julie's the co-leader, but we also have various assurance people that are involved at the partner level. There's Brian Finnegan that works a little bit with life science companies, as well as Jeff Pearson and Rich Bellucci and Nick Steiner. And then on the tax side, we have Bob Houston and Jim Parks and Julie West that do a lot of the tax work. For valuations, we have Brooke Bailey and Bob Chung that work with life science companies in those areas. And there's a lot of other people that make up the team. These are just some of the kind of the leaders that are working a lot with these types of clients. So my ideal client would be either a venture-backed startup or a small, medium-sized public company. I particularly like venture-backed startups because these are companies that are just being launched and they may have some exciting technology. But they would be companies working in the medical device area or the biopharma. So my best referral sources, I would say, are probably outsourced CFO firms. I spend a lot of time talking to outsourced CFO firms. A lot of times they'll be brought in to do the accounting for startup companies, and then they'll help make selections on who the outside CPAs will be. And often they'll start with income tax returns, and we'll get our tax people, corporate tax people involved. But when they get venture funding, they'll look for an audit, and then usually that's when the assurance people come in and help out. A company here in Menlo Park, it's called Ceterix, and Julie West was serving them doing the corporate tax work for them. And when one of their big four firms raised their fees, they asked Julie about another CPA in BPM that could maybe handle their assurance work, and she brought it to me. And we've been doing their audit now for 2 years, and they seem pretty happy. If you just communicate with your client like how things are going, sometimes clients will separate audit, tax, and valuation services, and they don't realize that, for example, if we're doing tax, we could also do valuation. And so sometimes what I'll do is I'll just talk to the client. I'm usually talking to them about audit, trying to get tax, because if we're doing an audit, we can't do valuation and be independent. But a lot of times, we'll start doing tax, maybe we'll add valuation and audit, and just kind of chatting with your client, finding out who's helping them out and seeing if we can add other services, and then just being aware of some of the other services we offer, like international tax, if they want to offshore their IP and try and save US taxes, international tax. And another area would be R&D tax credits is important to the life science industry, and so they may have some needs in that area as well. I'm on actually 2 boards. One is the St. Francis Foundation board, which is a foundation that supports the St. Francis Hospital in San Francisco. And through that, meeting doctors and other people in the medical area through working on that particular board. And I'm also on a board called Martin Luther Tower, which is an independent living facility in San Francisco that provides independent living for seniors. So both of these are what I would call kind of healthcare related nonprofits